Medicine and idea. Dr. Kavi, who is working as research officer at RIM Chennai, received the awards including Outstanding Student Award and University Topper in Knowledge with over 13 years of clinical experience. Dr. Karuki Sharan has published 23 research articles and holds a PhD in Knowledge. Currently, she is involved in 7 ongoing research projects at RIM Chennai. Let's give her a warm welcome and big round of applause. Please, ma'am. Thank you, Dr. Zoha. So we came to the final session of this seminar. So today is my talk on the invention of diagnostic and database devices in Unani medicine, and it is totally an idea. So what diagnostic techniques, what database we can approach in Ayush system. So before that, as we all know, this use of Unani along with Unani, the Ayush medicine, nowadays it is tremendously used by most of the people just because of the holistic approach, because of the least area report adverse drug reaction, and because of the less cost effect or the cost effectiveness. So most of the people are now approaching to the Ayush system. And during the pandemic time, we have seen all our witnesses for the effectiveness of Ayush, not only Ayush, the Unani medicine, that is one word used. Jantar is very effective in COVID for the prevention of COVID. That is Argyaji. People are using Ayush Kada, Mansuri Kada. So because of all this, individuals are now approaching to the Ayush system. But somehow the people are the access to the global community is very less. All this the major reason for the lack of the technology. So we can integration with the artificial intelligence can play a major role for the advancement of Ayush system. So I'm very much thankful to Dr. Sendil. He has explained all the most of the things related to the AI, sorry, artificial intelligence. So I'll just brush up few things. So as sir said, in artificial intelligence it is categorized or divided into the three parts, that is artificial narrow intelligence, artificial general intelligence, artificial super intelligence. So the first part, that is artificial narrow intelligence. So it is nothing but a machine learning. So particularly it is specific to the one area. We are giving a one. We are the scientists or the data scientists. They are targeted to the one area and they solve the one problem. So this area is very narrow. Okay, so with this AI, the capacity of this AI, they have narrow capability. So it will generate a few, or it will give the idea about the particular thing. And if we talk about artificial super intelligence, so we can say this will help in decision making, taking rational decision, and even it include like matter, arts or building emotional relationship. But the third thing is artificial general intelligence. As Sir said, it is still a concept, theoretical concept. So we are not reaching up to it. It is somehow how the human brain is working like that. So the advancement of AI, there are some advantage along with the disadvantage also. So in AI advantage, there is a reduction in the human error. It is 24/7 available, helps in repetitive work, digital assistant, faster decision, rational decision maker. It is helpful in medical applications and improves security like that. So in machine, these 3 points also Dr. Senthil have explained. Supervised learning, these are the type of machine learning. The first one, the artificial narrow intelligence, synonyms of the medical this machine learning. So it is categorized into the 3 types. This supervised learning, unsupervised learning, and reinforcement. So like in this image you can see supervised, someone is supervised about the algorithms we will train. give the input and output. So according to that, the algorithm is specific. And if we talk about the unsupervised learning, so this type of machine learning, we will scan the data set looking for any meaningful connection, and the algorithm is trained on the prediction and recommendation that the and in that the outcomes are predetermined. And the last one is reinforcement learning. So in this, what input we are giving, along with that itself, the AI will generate some predictions. Now the next term is deep learning. It is subfield of the medical machine learning. So in this, the algorithms, they are inspired by the structure and the function of the brain, like neuron cells. So here deep learning concept are used to teach the machine that what comes naturally to us or human. So using this deep learning, a computer model can be taught to run classification app like taking image, text or sound as an input. So nowadays this deep learning is a popular as the model can achieve the state of art accuracy. So with this help we can using the brain stimuli hoping to make the learning algorithm efficient and simple to user. So what is this neural network? So because this neural network is work on the similar principle as the human neural cells work. So they are the series of algorithms that capture the relation between the various underlying variables and process the data as the human brain does. So in this, based upon the set of the data, the neural network they predict whether it is a dog or a cat. So it comes under the supervised machine learning. Then with the given detail about the transition of the person, it can say whether the transition is fraud or not. And with the help of this neural network, it can be trained to recognize the speech pattern. And with the given output as an audio file, it can generate a new music based on the various factors like singers, genres. Then a well-trained this neural network can predict the stock price. It can train we can train a neural network that detect the misspellings and also suggest the similar meaning of the word like how the Grammarly does. Then character recognition. So with the trained neural network can detect the handwriting character, and with machine translation we can develop a neural network that translates one language into the another language. And along with the trained neural network, we can process an image and extract the piece of information from it. So nowadays, in every part of our life, we are using some of AI, artificial intelligence, like online shopping. We are seeing with the help of AI, if you are searching something, so automatically the next time it provides personalized recommendation to use based on the previous search and purchase. Then digital personal assistant. So smartphone use AI to provide personalized services and can answer what questions and help answer to organize that daily routine without the hesitation. Then machine translation. So AI-based language translation software provide translation, subtitling, and language detection, which can help user to understand other language. Then it also helps in cybersecurity. So application of AI in healthcare, it helps in numerous areas like administration, telemedicine, assistant diagnostic, robotic assistant surgery, and other things also. So in administrative area, with the help of AI system, we can like routine administrative tasks can be minimized, and the human errors can be minimized with maximum efficiency. And in telemedicine, if we see, for non-emergency situations, patient can reach out to the hospital's AI system to analyze their symptoms, input their vital signs, and access if there are a need for the medical attention or not. This will reduce the workload of the medical professional by bringing only critical cases to them. Then in assistant diagnosis, through the computer vision we give number of data to the AI, the MRI scan to check the tumor and other malignant growth. So it will automatically it will give the faster result as the radiologist can, and with the minimum or no margin of the error. Next, vital state monitoring. So with this AI help, vital signs, we can use some applications which are available online that can monitor the vital and predict the patient's health condition. So AI integration, as my topic is invention of database and diagnostic devices. So we should know the priority domain in the Unani system. So artificial intelligence nowadays it is growing and it is changing the way of healthcare is delivered, and this AI is very much important to globalize, to give the global access for the system. So in this section, we will see what things or what are the areas where we can integrate the Unani or Ayush system. So these some participants are from other sites. So this is the brief history of the Unani medicine. That Unani medicine traces its origin from Hippocrates, who gave the theory or concept of the four humors: blood, phallic, yellow, white, and black bile, which is a foundation of the health and disease. And then further, Gallen refined the system and laid the groundwork for the diagnostic and therapeutic purpose. So in India nowadays, with the help of Ministry of Ayush, we are now this institutional, or what we call Ayush, this recognition is ensuring because of this practice, education and research what we are doing nowadays. So Unani medicine, the basic principle, first one is with the as every individual has its own temperament. So this temperament is influenced by the balance of the four humors. So if any imbalance in the humor, it can lead to disease. And the second principle of diagnosis is usul tashkil, with the diagnostic method with the help of clinical observation and patient interaction, like inspection and interrogation by patient's history and symptoms, along with the palpitation, other method, and with that pulse diagnosis also, it is one of the important diagnostic method, and urine and stool examination. So these pure diagnostic method is very much useful for the diagnosis of the disease in our system. So this diagnosis is very important. So how we can diagnose the disease with the help of AI. So the AI has the potential to significantly improve the accuracy of diagnosis. So it can assess healthcare provider in diagnosing disease based on the patient's symptom, medical history and imaging results. So it can process the vast amount of data and identify the pattern that might be missed by the physician, and can provide a more accurate and up-to-date information. For example, we train the AI algorithm on the large database of medical image to identify the disease, sign of the disease. For example, such as a chronic condition like osteoarthritis, osteoporosis, cancer. So these algorithms can then be used to analyze the new image and provide a more accurate result. Like this, AI can help reduce the likelihood of diagnostic error, which can occur when the healthcare provider misdiagnose a condition or overlook important symptoms. So we can train to identify the most important symptom and risk factor, reducing the chance of misdiagnosis. The second important thing, personalized treatment, which is very much important and are nowadays adopted in integrating medicine. So in this, it will improve the AI. It will significantly improve the delivery of the personalized care. So we can train AI algorithm can be trained to analyze the patient's medical history, lifestyle, genetic, and use of this information can create a personalized treatment plan. So this tailored approach to treatment is particularly important to Ayush medicine, where the patient often has a unique and complex medical history. So by using AI to create personalized treatment, healthcare provider can ensure that the patient receive the most effective treatment particularly needed for that patient. Then AI can be used to predict how the patient will respond to the particular treatment based upon the medical history, genetic and other factors. So this information can be used to optimize the treatment plan and improve the patient's outcome. Then next, we can opt, with the help of AI, we can go for predictive medicine. So this medicine will predict, with the help of AI, we can find out certain diseases, and these diseases will help to this will analyze the algorithm to predict the particular conditions like cardiovascular diseases, some sleep apnea diseases, and if we predict this disease, we can identify the individual at the higher risk of particular condition. Then clinical decision support. So it can be used, AI can be used to support healthcare provider for making information decision about the patient care with real-time evidence-based recommendation for diagnosis and treatment, such as which test is needed, which test to be ordered, which treatment to be considered, and what outcome will be it will come. So this will help to reduce the diagnostic error, to improve the accuracy, efficiency of diagnosis and treatment, and to improve the quality of the care and patient's outcome. So it can be achieved by using machine learning algorithms and with the help of NLP processing technique. So AI algorithm can be trained to identify the pattern and the relationship of the patient data, and to analyze the data such as medical history, symptom and test result to provide a list of possible diagnoses along with the most likely diagnosis and the best course of action for the treatment. Then next is analysis of Unani medication. So AI can be used to analyze the efficacy and safety of Unani or Ayush medication, as well as identify the new potential treatment based on the active ingredients in that formulation. So it can help integrate the optimal dosage for the various remedies, and can be used to identify any potential side effect or interaction with other medication. So through the use of machine learning and NLP technique, these algorithms can train on the large medical database to identify the active ingredients in different remedies. So it can train to analyze the text literature on the Unani medicine. So it can be used to identify the contaminant or toxic substance in the herbal remedies. This information can be used to create more accurate and up-to-date medicine database. So nowadays, in silico testing, which is the emerging field in drug design and development, so it is used to discover, so AI can be used to discover the drug target and generate chemical substances, and AI can predict the property of the drug, and this in silico research offer a potent tool for predicting the therapeutic potential of the new drug. Then nowadays it is very difficult to identify the drug due to the large number of medicinal plants and their close similarity with the various species. So improper drug identification of the drug lead to reduced quality and altered efficacy, and sometimes it may cause a serious consequences. So with the help of AI-enabled image processing app, we can find out in automatic the identification process with rapidity and accuracy. So we can generate one app in which first we have to make one database in which we will add a multiple pictures with multi-angle facet. So it will so whenever by the time this app is ready, so if we put any image, so it will identify whether the drug is original or it is adulterated. So it's just an idea. If we talk about in regimenal therapies, so AI enhanced Hammam regime In this, we can opt for AI-driven personalization for improvement of therapeutic outcomes. So these devices can integrate to monitor the environmental conditions like how much should be the steam temperature, humidity, and duration. So according to that, we can use to analyze the heart rate variability, oxygen level, and based upon this, we can personalize the hammam treatment. Then non-invasive monitoring devices for leech therapy and massage. So with the help of wearable biosensors, we can use to capture and analyze the real-time on. So with the help of AI wearable devices, like if we put leech therapy, leeches of the body or the affected parts, so we can see the blood flow dynamic with the help of graph, then toxins level and the tissue healing rates. And for Dalak massage therapy, how much pressure we should apply, pressure applied, duration, how much pressure should be applied, the duration of the stroke, how much stroke should be applied, and then biochemical impact. So with the help of AI, we can use this AI wearable devices, which will be useful for personalizing AI regimenal therapy. Then AI in biomechanical analyzing of Dalak massage. So system can be developed for analyzing the mechanical and therapeutic effect of classical massage therapy. So in this, we will see the motion capture technology can be implemented to record the movement during the massage. So this pressure sensitivity max and even gloves can be used to quantify the force application. So how much force is applied, we'll get an idea from this AI algorithm, and we can train this AI algorithm can be trained to map the biomechanical data with outcome like pain relief, improved mobility and muscle relaxation. So yeah, next is AI telemedicine for regimenal therapy. So virtual consultation platform can be developed where AI assess patient data and suggest the appropriate regime. So AI drive wearable device can be integrated for the remote monitoring of the therapeutic effectiveness. The next is virtual reality and AI for regimenal therapy training. So with the model we can create for therapists who perform this therapy like leech application, pajama and hammam, and the AI-enabled application can be used to provide the feedback on the precision and adherence to the classical method. So all this, almost I have explained all the things like AI enhanced diagnostic, machine learning algorithm can help for nerves, pulse pattern and biomarkers used from the urine and stool to find out the diagnosis, and the clinical decision support system can assist the personalized treatment planning. Wearable health monitoring device. These devices can track the heart rate, temperature, dehydration level, and the sleep pattern. It will can help to assess the result dynamically, and the AI integrated biosensors can monitor the humus imbalance and detect the early diseases. Then telemedicine and digital health platform. So virtual consultation can make Unani medicine more accessible, and especially in the remote areas. And AI powered chatbots and virtual assistant can guide the patient in lifestyle modification based on the Unani principles. Then exam with the help of AI, in biomedical imaging and computation technology, AI drive excreta analysis can enhance the accuracy of stool examination, and advancement image technique can assist in tongue, skin and eye diagnostic, which will improve the inspection based assessment. Then large-scale Unani medical record can be analyzed to discover the pattern of disease, progression and treatment outcome. Along with this, these two already I have explained. This part computation modeling can optimize the preparation of Unani formulation, and AI can also predict the herb-drug interaction, which will enhance the safety and efficacy. So, for diagnostic device, for evaluation of diagnostic device in Unani medicine, there is a need for integration of modern tool with Unani diagnosis and development of variable health monitoring system. So some digital nerves pulse analysis devices we can make. We can use AI drive pulse analysis for precise temperament evaluation. We can go for early and because of this, we'll get the early detection of the disease. Urine and stool analysis kit we can prepare, and portable devices for immediate clinical analysis, physical analysis for digital analysis for physical and chemical properties. Some AI powered database we should go for it will help in the administrative or administrative purpose like electronic health record data for Unani practices and AI drive diagnostic assistant based on Unani principles and integration of some clinical trial data for the evidence based medicine. Database development for Unani medicine plant and their interaction is also important, which can be used with the help of bioinformatics and AI assistant formulation development based on the result. It will also help. It will also help in find out the predictive diseases. Then, with the help of telemedicine, patient or the remote, those patients who are in remote area, we can they will get a consultation, and it will consult. And this definitely for this we have to prepare one diagnostic software. Then, mobile application for self-diagnosis and monitoring based on Unani principles. These application also we can develop. Some challenges and future prospects. So, for developing this Unani diagnostic device, regulatory approval is needed, and it is need for the clinical validation and standardization, and this expansion of this AI-powered database for the personalized treatment in Unani system. So, AI integration of this AI in Unani medicine is very important for predictive analysis, for treatment, machine learning in Unani medicine, and real-time patient monitoring through the AI-based wearable devices. Then, along with this, I think Dr. Satish Kumar explained in his presentation that government should go for the concept of Unani Healthcare Center, AI-powered Unani Healthcare Center. So there should be some AI-powered Unani Healthcare Center and the integration of robotics in the Unani therapy administration. So with these two things, I think it will take time, but definitely it may come in the future. So with the help of this AI-powered clinic healthcare center, patient can become patient can approach with the AI and whether what kind of treatment, what kind of Unani treatment is needed, they will get an idea. And with the robotic in Unani therapy, like how we can apply leech therapy, how we can do massage and other regimenal process. So all this in that all this procedure, regimenal procedure can be opt in the robotic in Unani therapies. Then my conclusion, there is we should emphasize the need of innovation in Unani diagnostic tool and the role of AI, bioinformatics and variable devices are very important to enhance the Unani system to reach or access the global community. Thank you.